Okay, ladies and gentlemen, this is Brock Beard from NASCAR.info, and again, continuing with the recent string of very major news stories coming down the pipe. Certainly had to chime in, certainly on this one. For those of you who don't know, the COVID-19 precautions have now extended into much of professional sports with a series of cancellations and postponements in the name of making sure to prevent or reduce, rather, the spread of the COVID-19 illness or virus, rather. The NASCAR protocol originally had been to restrict, to create like 6 foot barriers between non essential personnel and the competitors to create as much separation as possible there. But that has since changed to even more significant measures. Originally, it was going to be that they were going to be canceling the events at Homestead in a couple of weeks, but Atlanta was going to stay the same. And then that later then changed to both Atlanta and Homestead both running their races with no fans in the stands. Both track companies have been thus involved in this between SMI and the former ISC Corporation. They're working out arrangements to make sure that the fans who are already planning on being in attendance are able to pick up another ticket for another race either later this season or next season. They have very similar deals, at least from what I'm hearing so far on that. But I think there's a lot. Obviously, there's a lot of anxiety about this, and I definitely wanted to make sure that I chimed in on this, not simply just to talk about it because everybody's talking about it, but much like in the discussion last week about drunk Brian France and the lawsuit going on there with Brian France. This is also something that I just happen to have a bit of background in. Again, to just kind of put my credentials out there on this one, to make clear right off the beginning, I am not a doctor. I don't profess to be one. Not a nurse or X-ray technician. But for the last 5 years, I have worked in an inner city emergency room on the night shift. So I have had a lot of experience working in a medical setting and again, continuing right through this particular situation. And I've been able to see the response on the inside there to some of the, of course, these concerns about COVID-19. There's not too, I can't disclose everything about that because there are certain patient privacy issues that are key. But I do think that, again, I want to kind of merge the discussion here into what I can offer here to, again, much like last week, kind of demystify the process a little bit and at least give you some information on what I'm seeing here on the West Coast. My position is I register patients in the emergency room. That is how that's my day-to-day job or my night job there. Great staff over there that I work with there. I've worked alongside the doctors and nurses and so on there. Basically, my job is just to register the patients, which is verifying people's demographic information and medical insurance, customer service in general, but also working. You really have to work face to face with a lot of patients that come in. And I've already seen a lot of changes in that just from the shift I just came back from last night. That they've already they're taking things again very seriously with this, but again, still keeping things in perspective that they're instituting these protocols here with the interest of just making sure that it doesn't spread to anybody else and making sure everybody stays as safe as possible. So in discussing this, I kind of want to merge that into this and talk about that there. Really, the biggest thing I think that really what we can talk about with the actual issues there with the illness. And I think that chart that has been circulating around showing the two different graphs there about the expense, or the use of medical facilities versus the number of cases coming in. I think that's the most instructive thing. I've seen it on Twitter constantly, and I think it's the best representation of it. The biggest thing with working in the medical profession is there are only so many beds, there's only so much time, so much staff, and you want to make sure that the staff is able to serve every patient that comes in to the very best of their ability. So what they need to do and what they are doing, and they meaning just the country and CDC and everybody else is encouraging, is just making sure that again every measure is taken to reduce the chance of it spreading in a large and creating a large surge of patients that would have to come in, because that of course would make it very difficult for anybody to receive treatment at that point. Certainly with the issue with this particular illness, and again, I'm not a doctor, but I do have to be familiar with some of these terms to do what I do, because again, for example, if I'm talking to a patient, I got to literally go into the room and talk to the patient. I have to be very aware of what condition they're being seen for and to wear the proper protective gear in those cases, even before all this happened. So there's the same thing there. The biggest distinction with this, and this is what they call a droplet precaution, at least at the hospital that I work at, with this particular illness that has been discussed, and I know there's a lot that people are still figuring out about it. Apparently, it is close contact that is the biggest issue there in terms of spreading the illness. And what a droplet precaution is that, you know, if you sneeze or if you cough or something like that, then that the illness is spread through like what comes out of your mouth or what comes out of your nose when you're sneezing or something there. But the difference with that is that since it's like a liquid, since it's that, the trajectory is not very far. And that's where you hear this 6-foot barrier thing come up a whole lot, especially last week. It's trying to prevent close contact. You know, somebody sneezes and, you know, they're just right next to you. You probably don't think anything of it. But, you know, if the person has that illness and you're that close to them, especially if you're in a large crowd and you have nowhere else to go, that's a big concern. And so that's really why you have a lot of these restrictions there that are being put in place to restrict large crowds. And it's a preventative measure. It's that's I think the most important thing to really think about that. So you have to have a situation where people aren't put in that situation where if somebody just happens to have the illness or something else, that you know that they're able to stay safe. This is very different from, for example, an airborne precaution where the illness travels through the air and you know you have to mask up, you know, pretty much anywhere you go. In a droplet precaution, you don't necessarily need to. This is why you hear a lot of things from the CDC about not necessarily needing to wear a mask everywhere you go. It's again, that close proximity is the big issue. An airborne precaution, that is more like it's an aerosol. It's something that floats through the air and it's something you can breathe in very easily. That's not from every report that I have heard, and from every report I've heard so far on this so far. And again, we knock wood that you know it stays the same. That does not appear to be the case with this particular illness, and that's at least as of the moment that I'm recording this right now. So these are again you see why these measures are being taken. Again, trying to kind of demystify that process. Um, when you talk about these different protocols, it's the same thing that when somebody comes into the emergency room, you'll see even before all this happened, you'll have people mask up if they show some of the symptoms. And the big symptoms that everybody's looking at is you know a cough or a sneeze, you know, a fever, or any kind of bronchial like pain or any kind of lung issues there, breathing difficulties. Those are the big things that they look at. Even before this happened, there would usually be a protocol in the emergency room where people would wear masks in that case just to make sure it doesn't spread to anybody else. So whether it was an airborne thing or if it was a droplet precaution, while they're waiting to be seen, they're making sure that they're not spreading it to anybody else. A lot of the protocols that I've seen have really just kind of been even more firm on that and making sure people that do believe that they have those conditions or are complaining of those issues, that they make sure that they wear those masks to not spread it to everybody else. So that's why, again, you hear a lot of times with people wearing masks and that they have to mask up, but it's not necessarily something that everybody else needs to do, at least at this moment. Again, these things are always evolving situations. We've certainly seen that all week, but that's been another part of it. What's the other? I'm just thinking here. The oh yes, the other thing to really hammer home on this is I know that a lot of people have been talking about like statistically and whether people have the symptoms and everything else. The symptoms that have been discussed in general also do come up in very commonplace illnesses. If it's a common cold, if it's the flu, if it's a bronchial infection, if it's any of those number of things. Again, just from my own awareness, I'm not professing to really have a solid detail on that. But if you have a patient that presents themselves with these particular issues, it doesn't necessarily mean that they have COVID-19. Sometimes, and there are processes in place to make sure that people are screened properly and to make sure in a very quick sense here that people are able to eliminate those possibilities. And I think that's another thing that people need to keep in mind as these protocols are coming out here, that it is statistically very possible that even if you have these issues, even if you have a cough, even if you have, something like that, that it could be explained by something very, simple. But again, I'm not saying to disincentivize you from going to the emergency room, because of course that's what they're there for. They're 24-hour facilities. If you ever feel that you really need to be seen and you feel you have this concern about it, by all means get treated. That's what they are there for. That is a service that they are certainly happy to provide. But I think it's very important to point out that it's, just because you have the symptoms, it doesn't necessarily mean that you have that condition. For example, me, I have seasonal allergies. So, and of course, the trees are in bloom over here in California, and I'm feeling like the sneezing and stuff from that. But I know from that it's responding to that. I feel the same symptoms from that, but I don't feel anything anything different from that. But it's a different issue with that. So again, we're all concerned and we're all in this together. I think that's really been the biggest thing. I think these are major and unprecedented actions, certainly in the scope of this. But everything is, again, I think, a very preventative measure, and just making sure everybody's as careful as possible. The people that do show the symptoms of the illness are treated properly and transported to the proper locations and quarantined. And again, and even people in those situations, that they're quarantined in the proper care. I've been in these negative pressure rooms that you keep hearing about in the news. And again, they're very, I think personally, they're some of the most comfortable rooms in the emergency room, because they also keep things pretty quiet from the rooms next door. Not to make light of it, but it's certainly that there are facilities that are in place to make sure that, if you are seen, that they are going to make sure that, your illness isn't going to be spread to anybody else, and they'll give you the proper treatment. And from what I'm hearing too, the tests sound like they've really advanced in leaps and bounds recently. I'm not so much hearing this from work, but from other sources online talking about the test used to take like a couple of days to find results. Now it's getting down to a matter of hours, and now perhaps even just fewer hours than that. I think it really speaks to the efforts of the global community to really realize that this is a common issue that everybody needs to be working through, and that they could find a way to work through this. I'm also encouraged by other reports from other places that had high results of COVID-19 that have since scaled back. That there have been fewer results. Some places, even in China and Southeast Asia. And other countries, of course, have been on the other side and then have had, serious quarantines like the one in Italy. I think here in the U.S., we're trying to learn from every possibility. And again, everybody there has been very, hard at work to make sure that they are prepared adequately for anybody that comes in that even believes that they have any of those issues, but also making sure that they are processed in such a way that they're not going to be spreading it to anybody else there. So the biggest thing, again, I don't really have much to add in terms of what the CDC is providing. I'm sure like all the coronavirus videos being posted on YouTube here, providing links. I'm sure the link is probably below this video by the time you're seeing this, to the CDC and information about it. Just make sure you wash your hands. Make sure you don't touch your face if you can help it, or make sure you don't touch your face with unwashed hands. If you feel sick, make sure you stay at home. If you have to go to the emergency room, make sure you wear a mask. These are like the biggest things. And I think the other thing too, and speaking from, again, somebody that works in the emergency room, is also be patient. Obviously, these are times where you're going to see a lot more traffic coming into emergency rooms than usually you would. But there are emergency protocols in place. And of course, the hospitals are very aware of situations that they need to change their strategies a bit to make sure that patients are treated as quickly as possible. But going into the emergency room, I'm afraid, is not like going to Jiffy Lube. It's not like going in and getting your oil changed and you're going to be in and out in 15 minutes. Even before COVID-19, you can be in there for, for a little while. It depends on, what lab tests or anything are being done. And again, I'm not saying this to disincentivize anybody, far from it. If you feel the need to have to go to the emergency room, you absolutely go. But I am saying this in terms of just making sure to reduce the anxiety there. And, if you ever find yourself in that situation where you're having to go to the emergency room and be treated, if you feel like you're just sitting there and waiting and all that, that's a very common thing that's happening right now. And the hospitals, I can tell, certainly, even from what I do, where it's like I always consider it like an eighth responder or something. It's so far down the line. The customer service angle of it, I see a lot of it, and a lot of the same frustrations that come through there. And all I can say is that everybody, again, is very patient as possible, and we're all in this together, and nobody's going to be ignoring you for treatment. They're going to make sure that you get the treatment that you need, and screen you as best that they can. And if they can explain it away through their own expertise, that it is, you just have a cold or you just have the flu, because we are still in the middle of flu season. We're getting towards the end of it. Cold and flu season, and even seasonal allergies or any other number of things that are going on here. That's their job, and that's why you have like a triage in place, and you have everything else that's done there. So again, I'm very encouraged by the response that I saw at my particular hospital. We always make sure we have discussions before everybody starts their shift, and right from the start, everything was COVID-19, making sure everybody's questions were answered, making sure everybody had the right protocol, and make sure that everybody had the gear that they needed to treat the patients properly, regardless of their position. And some great teamwork over there. Again, I wouldn't be working over there if I didn't believe that. They're fantastic people over there, and if every other hospital out there is doing, even the same level of skill there, I think that everybody can be rest assured that it's going to be very helpful there. So again, I just want to make sure I put this out there. I don't really have too much more to add beyond that. I certainly don't want to speculate on the medical aspects of it, everything from that, because it's a continuing developing story. But again, much like the discussion last week, I want to make sure that I'm providing any of my own experience on that same side. So this is so again, but I think really bringing this back to NASCAR itself, and really other professional sports at this point. Again, like I put in on the screen cap here, it's better safe than sorry. I know that gosh, I mean, there's been no shortage of just crazy stuff that's happened all this year, and this COVID-19 thing's been in the background of all of it. But again, it's a preventative measure. They want to make sure that it doesn't spread as easily there. If there was another way that they could just literally make sure that there was 6 feet of space between everybody in the grandstands, and everybody just stayed in their one seat, they probably could have made that work. But as you can tell, that's just not workable. Large gatherings here in California, it's the same issue as a lot of other places here in the country. Of course, we see it in indoor sports, whether it's basketball or anything like that. And I know that this is a time of year where a lot of that stuff is picking up. And it's very possible that in NASCAR's case, their situation could always change. I'm sure they're going to be very mindful in these next couple of races here to see what goes on, if anybody else picks up the illness. And if that's going to certainly change their approach. But if it does change their approach, it's again going to be more towards preventative measures, towards containment, towards making sure anybody who catches the illness gets the treatment that they need when they need it, and that anybody else is able to stay safe there. So, and that's what I want to make sure that I really hammer home. And I'm sure you're hearing it plenty much already, but it does bear repeating, because I think that, well, gosh, if this isn't a compelling reason to bring it up. It's certainly, I don't think anything else would be, but yeah, just make sure you just wash your hands, try not to touch your face. If you have to go to the hospital, make sure, and you feel like you have those symptoms, make sure you wear a mask and you make sure you keep that mask on. You've seen some of this footage in other locations where people are like taking off their masks and then they get, intercepted or something like that. If you do feel like it, until you are cleared, you want to make sure you keep that mask on unless a healthcare provider tells you otherwise. That's really the biggest thing there. But again, much like I said with the Drunk Brian France video last week, that's crossing the bridge. Even if you're not having the symptoms here, that's where you don't need to be wearing the mask. You don't need to be doing all that, from what I'm hearing. Again, and we'll see. Definitely stay tuned online here, and as the news stories come out, primarily to the CDC's website. I would defer to them for really all the updates there, because they're going to have all the information that is being brought to bear for everybody else. So that's a very big thing there. But yeah, so I think that there's definitely an issue on here about, we don't know what's going on, and I know that's an intimidating thing, but we're all figuring it out here. And really, I guess, it's looking ahead to the season itself. I mean, how much longer is this going to be? I think the best way to approach it is just a week to week basis, or even a day to day basis. And just be as flexible as we can. Obviously we're no different than other sports fans and other things, or other people that are, we're going to, concerts like Coachella and these other things that have been rescheduled, and all that. Just be as flexible as you can, and, and everything. And just make sure that you're very careful about what information that you receive, and everything, because it is a changing situation. There's gonna be a lot of speculation out there, much like we've seen with pretty much every story we've talked about this year. But yeah, definitely defer to the CDC for more updates on that. But again, I hope this helped in some way. Again, shout out to my coworkers over at the emergency room there, 24-hour facility there, and great staff of people out there. But and again, just stay safe out there, everyone, and we'll have more updates through the weekend. I'm having a couple computer issues here on this side, so hopefully we'll still do a live stream after the race this weekend on Sunday. If not, it might, the audio video quality might be a little iffy. We're still kind of having issues with that. But we'll play it by ear from there, much like everything else, and have more updates from you there. If you have any other questions that I didn't cover on this, or any other things you're curious about, feel free to leave it in the comments. I'll check that out as soon as I can. But in the meantime, again, thank you everyone for tuning in, and we'll have some more information whenever the next big story is. My goodness. All right, but stay safe, everyone, and thank you for tuning in.